Hi, everyone. Welcome to this first webinar of iAccelerate project series. In this first webinar, we are going to have a super exciting experience talking directly with real patients. They are going to tell us about their experience when implementing technology within hospitals and how is the better way to work with them. We have here our neurologist, Laura, and our partner, Eleonora, as well from UniPD, and Carlos from Erasmus University. They are going to provide two very interesting presentations, and a panel discussion with the patients. I really hope you enjoyed this webinar, and I give the floor right now to Carlos, and let's start.
So Lola, thank you very much for the invitation. Thank you very much, everyone, for being here today. My name is Carlos. I'm a PhD candidate at the Erasmus University in Rotterdam. We are, as a PhD, I'm participating in this project, conducting some studies about patients' preferences for remote monitoring Parkinson's disease. And I believe in this presentation, my idea is to present a little bit, just a small summary, an introduction of the topic, just to put everyone at the same page, and also to show a little bit what we did as an introduction for the debate with patients, and of course with Laura, the neurologist. So the topic from today is actually what we can learn from patients participating in technology pilots and developments. And I will start a little with a small summary of Parkinson, just to remember everyone that, of course, Parkinson is a neurological disease, and it is a very important topic nowadays because the global number of patients is increasing. This is much related, of course, with the aging population. And Parkinson is a disease where you can have, maybe most of you already know, you have like motor symptoms, non-motor symptoms, cognitive symptoms, and usually affects people after their 50s, 60s years old. But Parkinson is a interesting disease because Parkinson has no biomarkers. What do I mean with biomarkers? Well, biomarker is a biological molecule that we can find in our body, our blood, body fluids, tissues, that can be utilized for diagnosis or follow-up. A very simple example is, like, for example, let's think about the glucose. If you have diabetes, you check your glucose in your blood, and of course you'll see that the levels of glucose are high. So you may have the diagnosis of diabetes, and when you are taking the medications, you are doing the treatment, you can follow the levels of glucose, and you can see how the disease is, how the disease is responding to the treatment. So biomarkers are very important because they can give to the healthcare providers the information they need to adjust the treatment and to check the progression of the disease, and to, of course, make the best choices for everyone. But Parkinson, we don't have this biomarker. We don't know exactly. We don't have a blood test. We don't have a image test. We don't have a biopsy, a tissue test that can tell you in what phase of the disease you are, and how you are responding to the treatment. Basically, the measurements and to understand how you are responding to the treatment is limited to the visit to the neurologist. So actually everything is determined during the doctor visit, the doctor consultation. So the accuracy of the treatments will depend very much on the physical examination and the history told by the patients and caregivers to the physician. But of course, Parkinson's is a complex disease. Like I told you, it involves motor symptoms, non-motor symptoms, cognitive symptoms. Some cases where when the disease progresses, you may have fluctuations, which are the symptoms. They appear for a period, they disappear. When you take the medication, you feel well. At some point, you start to have symptoms again. And dyskinesia, which are involuntary movements caused by side effects of the medications. So it's very difficult for the patients to recall everything, all the caregivers to recall everything that happened in the past months, to tell exactly what happened to the doctors, the side effects from the medications, how life is going. Also, you have the cognitive symptoms, which are very difficult to describe. Non-motor symptoms, for example. So it's very difficult. So usually the adjustment of the treatment, because the information that doctors and patients can share is usually not 100% accurate. So the adjustment of the treatment is sometimes suboptimal. And there's not a biomarker to help to check this, right? So to check if everything is going well, if the disease is progressing, some kind of element that helps to bring this information or to bring more objectivity to this information. That's why in Parkinson's disease, okay, there's a mistake in my slide here, but okay. In Parkinson's disease, the use of remote monitoring holds great promises, because with the use of these digital tools, digital solutions that can be wearables, sensors at home, cameras at home, you can collect information about how the patients are going in their normal environment, in their home. And because of that, you can have you can collect a very objective information. You can follow the symptoms day by day. You can follow the symptoms after taking the medication. If the patients have fluctuation, how many fluctuations do the patients have every day, or if the patient is having dyskinesia, or, well, you can have a very detailed description of how the patients are doing. And with this information, the healthcare providers can perhaps adjust better the treatment, personalize the treatment, right? And to timely adjust the medication or indicate the implementation of device-aided treatments for Parkinson, trying to increase the quality of life and improving the outcomes of the disease. However, there's a big problem when we think about, despite these promises and despite this hype around the remote monitoring solutions, there's a problem of patients' acceptance and adherence to these solutions, right? We know that based on the previous works, that clinical adoption has been hindered by complex challenges, including usability, stigma of patients using these solutions, private concerns, costs. And here's an example about a recent paper from 2023, where some colleagues, they were testing the usability of this remote monitoring device developed by Philips. And you can see for a number of 21 patients following this small trial, the number of days where with which those patients complied using this solution for more than 8 hours a day, you can see that was very, very small, right? So you have some patients using less than five days, 8 hours a day. So the idea was for the patients to use 30 days, 8 hours a day the device. So you can see that you had some patients using 5 days, 6 to 10 days, 11 to 15. So the compliance is not that big, despite all the promises. So because of that, in our Accelerate study, we decided to study and understand the patient's preferences for remote monitoring devices through interviews, focus groups in a first phase. And we tried also to quantify this a little bit more with a survey in a second phase. So patients were actually recruited in the sites of the Accelerate project in Finland and Italy. And they were all patients in risk of developing advanced disease, which could benefit the most of these remote monitoring solutions. And now, okay. And what did we learn with the patients, right? So, well, first, results from interviews and the focus. So the first is that the patients, they expressed willingness to accept the remote monitor solution. So in overall, the patients are open and they are willing to have it, right? And also during the interviews, we noticed that the potential benefits of these solutions, for example, better symptoms control, they seem to outweigh the most technology-related inconveniences. For example, some kind of a little bit of stigma, a little bit of privacy. So we had some patients saying, like, for example, this quote that if this method could yield significant results, the patient would even wear the remote monitoring in their ears, right? But during the discussions also, despite this acceptance, this acceptance is not like, oh, we are going to accept and that's it. Well, the patients mentioned that some issues will come with this remote monitoring. So the data privacy. So patients, they really expressed some concerns about the privacy. And one important fact is the use of video recording at home, which they expressed some concerns. Of course, stigma using these devices, certain kind of intrusiveness. So how much time do you have to use this every day, 24 hours a day? And of course, for some patients, also the costs, right? So depending on how the system is proposed to the patients. To quantify a little bit more this, we developed a survey where we showed to the patients 12 situations showing 2 different monitoring solutions, remote monitoring solutions, changing in terms of the frequency of monitoring, the use of video sensor at home, some different symptoms controls, and together with the option of no monitoring, right? And the results showed 3 different patient populations. A population of patients which we classify them the adopters, which are usually younger patients showing initial symptoms of Parkinson with high digital literacy, that the main characteristic is that the benefit for them matters. So they don't care very much about the frequency of use or even the privacy, but if they see benefits, they accept this solution. So they represented 50% of the sample size. We also had some kind of selective users, which are patients also with initial symptoms, but with relatively higher educational level and a higher quality of life, where the benefit also matters, but they really pay attention on the frequency of monitoring and the privacy too, showing that they would not like, depending on the symptoms control or the benefit, they might not accept the video recordings at home, and they might not accept to have long periods of monitoring. And we also found the tech hesitant people, which are usually patients a little bit of a relatively older age, presenting more advanced symptoms, and relatively less educated with lower data literacy, which they do not accept the solution, and they represent 10% of the share of the sample size. So in conclusion, we can say that in general, the patients or the participants from the interviews and the survey, they expressed some kind of willingness to accept the remote monitoring, but to use or to embrace this remote monitoring, to use or to accept at home. So the symptoms control are important when the patients are deciding to accept these digital tools. And we also recognize heterogeneity in terms of acceptance in remote monitoring in Parkinson's disease. So one size does not fit all, and this has to take into consideration when actually developers of the new products or even healthcare providers are offering this kind of monitoring solutions for patients, because not all of them will accept it, and you have to tailor a little bit the approach depending on the patient's preference. This is the result from our research. So this was our introduction, just on what we did, our findings, and just to stimulate a little bit now the conversation. And I will give back the floor to Lola. And if you have any questions, would like to contact, don't hesitate to send some questions. Thank you.
Thank you very much, Carlos. Very interesting presentation. As stated in the chat, please feel free to ask any questions during any time through the Q&A box, and the panelists will answer them when the moment comes. So don't be shy, share your questions. And of course, you can see all the questions from other people, so you can vote and comment on those questions to avoid repetitions. A lot of questions repeated through the different moments. So now it's time for Laura. So I give you the floor for the next presentation and the panel discussion.
Thank you. And thank you, Carlos. Very exciting news. The results, latest results I haven't seen yet. So it was very, very interesting. I think you got around 200 replies from Finland, didn't you? Yeah, for the survey.
Yeah, more than 200. We got 274 replies.
So Finnish Parkinson patients are very active in involving development. That's super great. Do you think that the survey might have selected more people who are interested in technology?
Yeah, we have to admit there's a bias in terms of technology safe patients in this survey, because it is an electronic distributed survey, right? So usually the patients with access of internet or patients with access of mobile phones, computers that can answer the survey. But it was interesting that also the patients that they refuse the monitoring solutions. We had a 10% of patients saying that, right? So they also appear in the survey, but we admit that a little bit of bias in terms of tech-savvy patients, I would say.
Yeah. So maybe a little bit more than 10% of Parkinson patients might be hesitant to technology, but still, that's if 50% would be interested in, that's a huge number.
But the interesting part as well is that we could understand that these patients with a little bit of with this hesitance to accept the solution, perhaps the cause it is because they are afraid of the technology, right? So not because they don't like the technology, but because they are afraid to use the technology. Once they are not used to technology, they might feel like intimidated. And perhaps for these kind of patients, some kind of educations in terms how to use, or perhaps this will solve the problem, right? Perhaps they will turn as a users if they have this kind of support. And this is also interesting. Of course, we don't have this answer, but it seems this is the cause, right? Because they are a very specific group of patients, usually a little bit older and a little bit with a lower digital literacy.
Yeah. Yeah, let's see. Rias has been commenting something.
May I ask one question that appeared here? Someone is asking about, you did the right calculation, right? So 50% adopters, 10% selective, and 10% deny. What about the rest of 30% of the patients? Indeed, I didn't show here. We are still analyzing the other 30%, but it seems that the other 30% they had some problems to understand the choice test, because this survey, it is a very complex survey, we have to admit, where you have to choose between different solutions. And one of the problems of this survey is that it's complex, and perhaps some patients, they didn't completely understand it, and or perhaps they had some kind of fatigue at the end, because it's also heavy to answer. And so this rest of 30%, we don't know exactly how to classify them yet. We are still studying the data, but it seems that there are patients that not fail the test, but perhaps the answers, they do not make much sense. But we will have a paper perhaps in the future, and where we are going to analyze these and have better results, or show a little bit these patients a little bit more.
Okay, thank you. Then I think it's time to continue, and I have to say that I'm super excited about this webinar, because this is something we haven't done before, to really discuss technology with patients actually joining us. I was planning to just briefly introduce to the audience first what kind of devices we have used here before we go into the panel discussion. I hope you are now able to see my screen. This is just a couple of slides that I'm going to help you to guide you through. So, oh, and maybe I need to introduce myself. I am Laura Mäkitie. I'm a doctor, a neurologist from Helsinki University Hospital. And for maybe 7 years, I have been developing different kind of digital solutions for Helsinki University Hospital, and especially for neurology and neurosurgery. But today we are talking about chronic disease and Parkinson's disease, and remote monitoring of the patient's well-being and symptoms in their normal living environments. We have developed this smart hospital care pathway and remote monitoring in a pan-European consortium. We have different hospitals included, many technology companies and non-profit organizations and research organizations like Erasmus. And this is what we are actually doing with our patients. We have 50 patients of monitoring themselves monthly at home for 1 year, and then we have 50 patients as a control group, and we meet all these patients 3 times during this 1 year follow-up. And similar kind of a patient cohort will be collected in Padova's University, Italy. Patients will have a couple of devices at home. All will have a smartphone, which functions as a data transfer ability. And patients are taking motion capture videos of themselves, as you have seen two figures here in the bottom. That's a solution of a Belgian company, Neuropath, where patients perform motor tasks on videos, and the solution will transfer the video material into numerical values. Then we are test using a consumer wearable from Polar, with which is a wristbound device, and we collect mobility like steps per day data and data of sleep. Some patients will use medicine dispenser robot, with which we get information of how they take medication. Then we have symptom diaries and electronic questionnaires from Health Village digital care pathway in Finnish with Finnish patients, and then Neuropath's navigator app with Italian patients. And University of Padova is developing a cognitive assessment application, which we will be using later on. So this is what we have performed with the patients. And now I would like to introduce you three our panelists, Jarkko, Mari, and Rias. If you could please open your videos. They are people with Parkinson's disease, and also they are doing this remote monitoring with the devices I just showed you. And I am very grateful for them to be here today to discuss about their experiences in the project. Maybe we could start by a brief introduction. If you could just briefly share with us if you want to share something about the disease you are having or how it's affecting you, and also what kind of background do you have? You are not just persons with Parkinson's disease, but you also have a life of their own and expertise maybe on some other issues. So if you could briefly tell us a little bit about yourself. Mari, would you like to maybe start? Mari, you are muted.
Yes, hello everybody, and I'm very grateful to be able to also to participate to this seminar, very interesting. And my background is so that I have worked as a chief financial officer for over 20 years in three different healthcare organizations, both in private sector, private companies, and the last was the big or the Helsinki University Hospital. I was there also as a chief financial officer. So my background and my working background gives me the advantage that I'm used to using technical devices, and I'm also interested in figures and measuring and follow-up systems. And in December 2017, I was diagnosed with Parkinson at the age of 52. And now currently, and I have also a very active sports background, and I have continued with very active exercise. And this monitoring also gives me a challenge to keep up the active daily exercise every day.
Thank you, Mari. Rias, would you like to continue?
Thank you, yes, and thank you for the opportunity to join the study and this webinar. I'm a 56-year-old engineer, Master of Science, with, let's say, a lot of commercial business career during the working life. It is about 10 years, so I was age of 46 when I got diagnosed of the Parkinson. And unlikely Mari, I'm not interested even I'm the engineer, I'm not so interested about the equipment, so devices and so on, and I have not been using any kind of monitoring equipment before. So this was a new experience for me for start to use this and monitoring myself, and it has been really interesting. For the let's say technical or let's say commercial background, I feel that this kind of Parkinson disease has let's say made me older faster. Somebody pushed the fast forward button and I got 10-15 years more suddenly. So this is how I feel. I guess this is okay for the short introduction.
Thank you, Rias. And Jarkko.
Hello for everybody, and I'm glad to join this webinar. I'm a 47 years old guy from the Tuusula, next to Helsinki, just 40 kilometers north. And I have had Parkinson's disease now for 5 years or more, 6 years. And I used to work as a service engineer on the vessels, on the ships, and installing all the marine things, navigation systems, fire systems, and all of those. And after I got the diagnosis, I was not able to climb a mast anymore. So they grounded me and put it to the office work. And now I'm going to, or have been 5 years at school, and I'm going to be an automation engineer. It's a re-education for my profession to be an engineer, and that what I can do now, to sit on the office. And of course, when the opportunity came to join this kind of study to get the new gadgets and devices, and engineer can't resist this. So everything new and interesting is fine for us. That's why.
Thank you. Maybe this will already show to the audience what enormous power we have from the patients. As you heard, we have 3 professionals who have expertise in purchasing and controlling finances in hospitals, and people with marketing and developing technological solutions. So if we would be buying this expertise from outside of the hospitals, we could never afford this. So this is very, very important part of the project, to bring all the knowledge of the patients for the benefit of greater amount of patients, of course, in the end. Thanks for the introductions. I have a couple of questions that I would like to discuss with you. Maybe we start first from the background you have. Jarkko, what do you think, as a very technical person, and you have been developing and using technical devices all your life probably. How do you see this solution we are developing and you are test using from a technical perspective? How would you consider it? Do you think it's worth purchasing for a hospital? If it's worth using? If there are some things that you consider problems with this kind of solution, how do you see from a technical perspective?
For a technical perspective, for all its working system, as what I am thinking. But only one thing considers me is that video making by yourself, it's a little bit difficult because you have a cell phone on desk front of you, and you have to go there and push a button to record a video and run to the camera and do the movements and then run back. And it needs some kind of device to trigger the video or something. But on major, it's working fine. There's have some updates, and they're working and making things even better. So I'm happy.
Yeah. So you have been taking videos approximately once in a month, and there is 12 videos to be taken. So between every video, you have to go back to the mobile phone and start the video and go back to the chair where you are taking the videos, and you consider that a little bit technically demanding, right?
Yeah, that's demanding. It's
Yeah.
easier if I ask my wife to push the button.
Yeah, that's true.
And I admit I have been lazy about the videos. I should make those more.
Rias, I know that you have already also you act as an Asahi teacher for other people having a Parkinson disease. From a marketing perspective, you have from your working career and your work with other Parkinson patients, how would you consider this kind of remote monitoring? Would you market this remote monitoring solution to your peers, to other persons with Parkinson disease?
Absolutely. This is very good. And I would divide this marketing kind of to the different segments. Generally, if we talk about the people who have, let's say, Western countries, West Europe, North America, people who have enough money to buy this kind of equipments and service, and are looking for themselves to how they improve their lives and how they extend their lives. So generally all the aging people, nevertheless what disease they have. So those are the people who are, let's say, the market. And then we have chosen people with the Parkinson disease. And of course, this is, as I said, accelerates the aging of yourself. So then you are more interested about how actually you monitoring yourself and what's going to be the next steps. If I can get any advice for the future, that if I'm going to be here after 5 years or 10 years, and in what condition, this would be a great, both for the patients and of course for the hospitals, for the doctors, and the point of medical, let's say, medication point of view. And of course, if this helps for the medication, it would be great, because my experience is that you easily kind of seek the right medication 1 or 2 or even 3, 4 years before you find the right medication. And one reason is that if you go to the public healthcare, then you have like a once, let's say 6 months or once 12 months meeting with the doctor, and then you get the new medication and so on. And then you, after 1 year, you come back and say, oh, this was not so good, instead of having some kind of remote monitoring and discussion and perhaps time in the phone and so on. So absolutely, this is really interesting for everybody, I would say.
This is a very good point that you pick up here. This would be a tool to increase the quality of care, increase the quality of treatment, not to replace something, but to make it better. Thank you.
Yeah.
Mari, you would be the kind of person in a hospital that I, as a developer, as a doctor, would come to humbly asking that could my hospital be buying this kind of a remote monitoring system and to use it with our patients? As a financial officer, what kind of advice would you give me as a developer? What should I consider? What should I take into consideration when I develop this kind of digital solutions for our patients?
I would say that that it's very important to have for each project to have a clear measurements and clear targets, and also show the way how the targets are measured, and that's the way to get the financing also.
So not just using some fancy technology, but really improving something.
Yes,
to be
yes.
able to show it.
Yeah.
Yeah. Then I would like to continue, Mari, with the second issue. How have you self experienced measuring yourself, your sleep, your mobility, taking the videos? What are your experiences? What has been good? Have you benefited for doing these measurements? And what would you like us to improve still with the technology you're using?
Yes.
The good things, the bad things.
Yes, I more or less have the remote control device on me all the time. So I have it all the time. So I want to also to get the real time and all time feedback for myself also. And what has been very important to me and valuable is to get the data on my sleeping habits. And it seems to, or the control system says that I have quite poor sleeping habits, and I see a clear correlation of how well or bad I have slept to the Parkinson symptoms. And with a very good night's sleep, then the following day might be so that I feel quite normal.
This is very important thing that you raise up. You are saying that you want to be active on your own health, on your own life.
Yes.
So this device might give information to your doctor and to your nurse, but you can also utilize yourself to improve your life and change your lifestyle, right?
Yeah, yes.
So there is a double benefit coming from the devices, of course, if the patient can see the results. Have you, or actually we discussed before, and I understood that there is a somewhat on a competitor in you, so you like to you are motivated by competition. So are you also finding these devices helpful to motivate yourself for exercises or for better sleep?
Yes, I see it very helpful and very useful. But there's also a risk that sometimes I feel that my body needs one day rest. But I'm still doing the exercise. I'm still heading for 15,000 steps a day, for example. Although I feel that body needs one day rest.
Yeah, so that can be also a problem of
Yes.
monitoring oneself. How about problems? Have you had any technical issues or other problems like this, what you just described, that monitoring oneself too much may also be harmful? Any problems with the devices and solutions?
I made the video with the movements yesterday evening, and then I also found out that it's for me it's not possible to make it alone. My daughter is helping me and pushing the buttons. And what would make it a little bit quicker is that you could save the movements and video clips on your own device first, and then after you have taken all the videos, then start the transmission of the data. to the data warehouse, because it's goes so slowly.
Yeah, it's taking too much time now and a little
Yes,
bit
yeah.
complicated. Yeah, okay, that's understandable. Have you used symptom diaries or these electronic questionnaires on Health Village digital Parkinson digital care pathway? Have you been using them?
I haven't used them.
You haven't.
I
Yeah.
know.
Okay. Any other comments, Mari, you would like to share us?
Yes, I just think as a patient that it's very important and very valuable what you are doing, and very nice to be part of it.
Thank you. Jarkko, would you like to share us personal experiences using these devices and solutions? Good things, bad things. One bad thing you already mentioned, the same as Mari, that it's a bit difficult to take the videos by yourself. Do you have any other problems with the devices, or have you find any benefits? What have you liked?
I would like it to use it. I have no big deals, no big issues with it. So I'm generally happy with the system.
Are you the kind of person who likes to see numbers and measurements?
Yeah, it's I'm constantly checking my pulse from the system, and I'm using two systems to check my sleeping, because I have a sleeping apnea as well. So that records my sleeping, and this I can make a judgment from the two systems and see how I'm sleeping. That's a good one.
Yeah, sleep seems to be an issue with many people, so these devices might really help on controlling them. And it's clear to me that you also are using the results yourself. You are not just collecting and making the measurements for your doctor or nurse, but you are you want to see the results, the measurements yourself also.
And it's like that, like Mari told just before, that if you have not enough sleep, your symptoms are very high and bad.
Yeah. Before and when you are seeing your own neurologist, how often do you discuss about sleep?
Almost every time,
Yeah.
because I'm living now my busy years, and getting sleep is enough sleep. It's a bit an issue. Last night about 3.5 hours. It's
Oh dear.
not so much, but there is another reasons for that.
Yeah. Okay. Would you recommend this system to other persons with Parkinson disease?
At least the younger people who are interested to use it. It's not for the older guys. It's a difficult to use for those. I think the Laura drop off now. At least the video drop off. Are you still there? Nope. She's gone.
It's just trying to reconnect her.
Yeah.
But just to following up a little bit your thoughts, I'm curious to know why do you think that it's a little bit difficult for perhaps people with a little bit higher age to use this? What are the tricky part of, because you are a specialist in technologies and you know how to use these things. So what do you think it's the bottleneck for people to use it?
We are used to use things like cell phones and smart watches and things like this. Those are not easier to people who are born in like 1950s or 40s. They use a wire phone and things like that.
But for you,
Carlos, Let me comment on this also. Regarding your study, the 30% of the people who did not kind of manage to answer the survey, correct?
Yeah.
Yeah. So in Finland, for example, let's say among the people who has the Parkinson disease, there is not perhaps 30%, but let's say there are notable amount of people who don't have email yet. We are in Finland considered, at least ourselves, we are thinking that we are one of the most advanced digital country in the world, but that's at least how we feel. Anyway, so there, and some people are really in let's say so bad condition. For example, their hands are shaking so much that the touch screen is really difficult to use, or small buttons. So instead of let's say clear big buttons, or general good buttons who make the sound of click when, and you know that it's you have pressed it, and so on.
Yeah.
So there is kind of this kind of physical limits, but might be sounds rude, but I would say that let's focus those who are now are able to use the devices nowadays, and those people who will be one day elder and probably have the disease, since as you mentioned in your presentation, the number of the PDs are increasing, probably because the life of human being is increasing, perhaps, I don't know. So that would be a kind of one comment so for that.
Thanks, Carlos, helping me out when I was dropping out, and thank you, Rias, for comment. We are running out of time, but I still would like to ask you, Rias, on your personal experiences on these devices. What have you found good, and what would you like to improve?
Generally, I really love this device. It's a good-looking device, and it's give me a lot of information. For example, it just taught me that I have been sitting too long time here now, so I need to go up and run. The other thing is what the one which is perhaps lacking. Perhaps it's in this devices already. I just don't know how to use it enough. So it's that kind of, let's say, I'm very poor to do exercise, any kind of exercise or anything myself. But if I can get, let's say, connected to some of the friends, or let's say this body and mind Asahi exercise group, so then that I could have kind of community where we can challenge each other and get the support from each other. So that would be kind of that would help me to use it. And for example, also I'm noticing that I'm doing 2 short nights. No surprises. That has been, let's say, I would say that almost everybody who are in the business working life so have lack of good sleep, and yeah. So it's kind of large questions how we can sleep more. And one I just called to one of my friends, and I said that let's start the competition, that after 1 month let's see which one is having the longest sleeps. And he said that I have different device, and I said that well, hour is an hour, doesn't matter which device is. So for the starting point, so some kind of this kind of communication increasing, and then this device, it's, let's say, consumer based, and it's nice design, but perhaps for the hospital or other use, you could perhaps have a kind of dummy version where you don't you don't have any display or any button or anything. You just have it in your, and then you get somewhere in the cloud SaaS system or whatever, it's getting this information directly to the healthcare people. Or you could have a really large display, for example, in the wrist or in the or some other part where you can really, that you don't need to have a mobile phone included. This is just an let's say opening the Pandora box.
Thank you, Rias. Yes. I am so grateful to you, Marianne, Jarkko, and Rias, that you shared your expertise and your experiences with us. I think we could continue for a longer time, but we are running out of time in this webinar. But we together will be discussing these issues, of course, when we meet next time in study visit, and we are taking your comments by other means also. So 1,000 thanks to you, and if the audience has some questions to you, then please use the chat. We only have a couple of minutes left. I have prepared a presentation of my experiences from this project and also from other projects. I think I will go through it very quickly and just raise up some major issues if there are something perhaps that we haven't discussed yet today. So if Lola will accept, we might go a little bit over time, but only a couple of minutes.
There is no problem.
Thank you. Okay. So one thing that I would like to remind the audience, especially if there are persons from technology companies who develop services for healthcare, is that doctors are very strong communicators. We make fast decisions every day, all the time, and we strongly communicate our opinions. That's part of our profession. So that might give an expression when we are developers that we know all the requirements of a patient. But you have to consider that we are, as doctors and nurses and healthcare professionals, we are experts on care process. And the care process is discontinuous. It means the touch points where we meet the patients. But the patients are experts on the patient journey, which is a continuous role of life. It means how the disease is affecting their working life, their social life, their hobbies, their families, and not affecting them. Patient journey also includes experiences. And even though we, as doctors, we think we know what is best for our patients, we have an emphasis on medical issues, and there might be some things that we really miss if we do not include patients in developing. And this comes by saying that healthcare is concentrated on measuring symptoms and progression of the disease because we have tools to help with that, while patients, as you heard, are concentrating on well-being, of being capable of doing things, and they are concentrating on health instead of sickness. And in healthcare, we would like to facilitate or use these digital tools to guide or sort patients to predefined treatment protocols, because this will save our resources. But from patient perspective, a personal and adjustable treatment plan is of course preferred for this kind of predefined protocol. And what good these e-health services and remote monitoring can bring is a feeling of security and connection to care team from patient's perspective. And that is something that is a little bit difficult to measure, but it might be of great importance for the patients. What I have learned from working with patients in digital services is that patients don't like reminders of the disease, and especially not the reminders of bad things that the disease might get. So while doctors are very interested in using validated tools to very accurately, very specifically find out what is wrong with the patient, this is a negative thing for patients, and they don't like to use this kind of questionnaires, for example, to report the symptoms. And most patients like to participate in their care and treatment, so patient-centric and solutions that provide shared decision-making is preferred by the patients. And of course, there is a lot of fear among patients that these digital services will end up losing the contact to their doctor and their nurse and just being taking care of some fluffy e-service, which they cannot really have any self-control on. And just lastly, couple of things to a couple of notes from Parkinson's disease, especially. This applies also to many other neurological diseases. Rias already mentioned these touch screens. We tend to provide mobile applications for all purposes, but actually touch screens might be very difficult if you have shaking hand or stiff fingers, and mechanical keyboard might then be preferred. Many neurological diseases make body asymmetric, so the left side is different from the right side, and that you have to consider when you are measuring movement, for example. A growing thing is voice control of application and solutions, and even voice monitoring of the disease. And voice control might be very helpful, for example, taking the videos we have discussed here today. But also in Parkinson's disease, there might be problems with articulation, volume of the speech, and that might bring problems for voice controlling. And cognitive decline, which might come with old age or some diseases, is making it a little bit difficult to use very complex solutions. I see a tendency that companies and also doctors would like to solve all the possible problems with one solution. And that's, of course, a kind of fine aim, but that usually makes the solutions very complex, and that might make them very difficult to use and visually very disturbing, especially if you have cognitive decline or just if you are tired. I think I only have the last slide here, and I would like to thank all the audience for joining us today. And I would like to thank the Accelerate Consortium and the partners we have, and working together. This has been very important to me and very exciting. And finally, of course, I would like to thank all the patients who are participating and giving their time on developing these solutions for patients. Thank you.
Thank you very much, Laura, and all the participants. Thank you for your commitment, for being here. We left 3 questions on the Q&A box. I don't know if you want to go super quickly through them. There is one question asking, do these remote monitoring devices require some kind of maintenance? If yes, how users manage it? And is it easy and understandable?
Yes, I can answer you about the guidance and maintenance. And yes, of course they do. There are constant reloads of the applications, and we have a nurse who is coordinating the devices, and patients can contact him anytime, office hours, and we will try to help with the problems with devices. I think we get contacts every week, not daily. But yes, maintenance is absolutely needed.
Okay, thank you very much. We have here a comment and a question. In previous studies done at hospital settings in Finland, it appeared that many patients did not have an internet access and or such phone that could enable to use of wearable wrist unit. This case came from Polar. My question is the whether a complexity of wearables use is hindering the use? If they were standalone, would the feasibility and acceptability be better?
In Accelerate, we are providing the patients with a smartphone. So the patients are not using their own devices or own smartphones, and that's because of the data privacy issues mostly. I think all the patients that we have recruited have their mobile phones of their own also, and actually quite many of our patients are using their own consumer wearables also. So we have managed to recruit very technically advanced patients, I think. With wellness wearables, there is a problem of that the devices will develop all the time. There are several kind of devices, and of course it will be a problem how to decide in real life what devices we would be using. Would we accept patients' own devices, or would we provide devices for the patients? So there is a lot of open questions what comes with the consumer wearables, and we don't have all the answers.
Definitely. Okay, and last but not least, there is a comment here saying sync takes place regularly, automatically when connected to cloud. Technical maintenance is little since they are charged with cable.
Yeah, that is true. And actually, it's very important to test use and select devices because there are things that you cannot really anticipate from just looking a box of consumer wearable, for example, or any medical device either. I strongly recommend to test use all the devices you consider using in hospitals, because they not necessarily work as promised, and there might be some disease-specific issues that you cannot solve just by thinking.
Okay. Well, it's time to close. I don't know if you want to give some wrap-up, some final remarks, or just a thank you to all the audience. You already did, but I don't know if you want to reinforce that thank you. I think it's been a really interesting webinar, super different with this panel, talking to the patients, having their experiences in real time here. I think it's super interesting, super enriching. So thank you all of you for this participation in the webinar. We hope that we can continue the discussion afterwards, and we wish you more nice experiences within this pilot and the project. And for all the audience, I would like to introduce the next webinar that will take place next week. It's more related to technology, but you can check on our website, iaccelerate.eu. And yeah, we hope we can see you there as well. Thank you very much.